The population I chose to study in partial fulfillment of MU 282, Music is Therapy, is hydrocephalus. The free dictionary online defines hydrocephalus as an abnormal expansion of cavities or ventricles within the brain that is caused by the accumulation of cerebrospinal fluid. It's estimated that hydrocephalus occurs in 1.5 out of every 1,000 births. The picture on the left shows a hydrocephalic brain. You can clearly see that the four ventricles are very enlarged. On the right-hand side, you see a picture of a normal brain. Why did I choose hydrocephalus? Well, my sister Hillary was born on July 18, 1980, with congenital hydrocephalus. Ever since then, I've been interested in the hows and the whys of the disorder. My mother didn't know that Hillary had a problem until just a few weeks before she was born. An ultrasound revealed the hydrocephalus. My mother was told that Hillary could end up blind, be severely intellectually disabled, or unable to do many of the things a normal person could do. The doctor wasn't being cruel when he told her this. It's just that people with hydrocephalus can present different problems at different times, depending on when it's acquired. I chose to do my PowerPoint presentation on hydrocephalus because when Hillary was younger, she spent many long weeks in the hospital several times a year. Hillary was and still is very uncoordinated and never learned how to drive a car due to poor peripheral vision. She had a hard time in school, especially with math. Were these things due to her disability? And if so, can I, as a music therapist, help others like her? I'm going to teach you many different things about hydrocephalus today. First of all, what is hydrocephalus? Number 2, did you know that there are 3 main types of hydrocephalus? Neither did I before this presentation, but I'm going to teach you a little bit about each one. Number 3, we're going to talk about congenital versus non-congenital hydrocephalus. Number 4, the symptoms of hydrocephalus. Number 5, how can we diagnose and treat hydrocephalus? 6, what are some of the possible side effects of this disorder? And finally, what are some ideas for music therapy treatment to help those with hydrocephalus? Well, first of all, let's talk about what hydrocephalus is. Jane Standley, a distinguished professor at the College of Music and Medicine at the Florida State University, defines hydrocephalus as an abnormally large accumulation of cerebrospinal fluid in the ventricles of the brain, resulting from improper drainage of the ventricles, leading to increased cranial pressure. As you can see from the picture, a non-hydrocephalic brain has ventricles that are not enlarged. The ventricles are in blue. On the other side, the hydrocephalic brain clearly shows that these blue ventricles have been enlarged to the point where there's pink around them, and the pink indicates pressure being put on the surrounding brain. Ms. Standley's definition of hydrocephalus is great, I suppose, if you're a doctor or somebody well-versed in medicine. Most people, however, are not and can get confused and overwhelmed. So let's take a closer look at the definition and try to make sense of what this disorder actually is. The word hydrocephalus comes to us from the Greek. Hydro means water, and cephalus means of the head. When one combines the two words, hydrocephalus literally means water on the head. However, the water they're talking about isn't water at all. It's actually something called cerebrospinal fluid, which after this I'm going to refer to as CSF. CSF is a fluid that acts as a cushion to the brain and a shock absorber to the central nervous system. If a person has too much CSF on their brain, the brain's 4 ventricles, or pathways for the CSF to move through, will enlarge to try to accommodate for it. The dilation of the brain's ventricles results in too much cranial pressure. This wide area shows the brain's 4 ventricles. This person has hydrocephalus. There are 3 main types of hydrocephalus. Communicating hydrocephalus is when ventricles of the brain are open and trying to accept the flow of CSF. However, the CSF is blocked somewhere after leaving the ventricles. The second type is non-communicating hydrocephalus. In this version, the CSF is blocked somewhere inside the ventricles. Also, it's possible that the CSF is blocked due to something called aqueductal stenosis, which is a narrowing of the ducts in the brain. Finally, there's something called normal pressure hydrocephalus. In this version, there's a blockage of CSF in the brain, but as the ventricles enlarge, they do not necessarily cause pressure inside the brain. What is the etiology of hydrocephalus? Congenital malformations is one of the leading causes of hydrocephalus. Congenital malformations are present when a baby is born. These congenital malformations may be caused by any number of things, not the least of which is environmental factors, genetic disposition, and developmental disorders. Non-congenital hydrocephalus occurs after a person is born. It can affect people of all ages, young or old. Traumatic head injuries are one way a person can develop non-congenital hydrocephalus. Certain diseases, such as spina bifida, can also trigger hydrocephalus. Now that we know what hydrocephalus is, let's talk about some of the symptoms we might see. Symptoms of hydrocephalus can vary according to the age of the patient when it appears. Here's a list of symptoms of hydrocephalus in infants. One interesting aspect of this disorder is that because of a baby's fontanelles or soft spots, they can handle increased pressure on the brain better than adults. The first symptom of hydrocephalus would be a rapid increase in the head circumference. If you take a look at the picture at the top, you can easily see that this little boy's head is a little larger than it should be. Number 2 would be vomiting and nausea. 3, blurred vision and sunsetting of the eyes. What sunsetting is when a child will open their eyes really wide and it looks like they're looking down perhaps at their feet or something on the ground without bending over. The boy in this picture is sunsetting. Another symptom of hydrocephalus is seizures. What are the symptoms of hydrocephalus in teenagers, adults, and the elderly? Well, first of all, they're going to have poor coordination and gait disturbance. In this video that I'm showing at the bottom of the screen is a picture of an older gentleman who has hydrocephalus. In fact, his is normal pressure hydrocephalus. Another symptom of hydrocephalus in teenagers, adults, and the elderly is slowing or loss of developmental progress. Also, changes in personality and cognition may come with somebody with hydrocephalus. And finally, dementia is another symptom of somebody with hydrocephalus. See how his steps are shuffle-like? He's having a hard time maintaining his balance, so he's hanging onto the wall for support. And now we're going to get a close-up of his feet. He's not lifting them up off the ground, and that's making it a shuffle step. How is hydrocephalus diagnosed? There are several ways that hydrocephalus can be diagnosed. One of these ways is through the use of a CT or CAT scan. If a patient presents with symptoms indicative of hydrocephalus, a doctor can order this special X-ray, which can take cross-sectional images of the inside of the body. MRI machines can also help detect abnormalities, which can lead to a hydrocephalus diagnosis. Unlike CT scans, MRIs use magnetic fields and radio waves to produce three-dimensional images of the inside of the body. Ultrasounds are another way that hydrocephalus can be detected. This is how my mother found out that Hillary had hydrocephalus. Now that we understand what hydrocephalus is, how can we treat it? Well, the most common method of treating hydrocephalus is through the use of a shunt. A shunt is a mechanical device that is used to move CSF from places inside the brain where a blockage is occurring to another spot where it can be absorbed by the body. The shunt is implanted underneath the skin. 40% of shunts malfunction within 2 years, and after 10 years, 98% of shunts have malfunctioned. This leads to additional surgeries necessary to repair or even replace the shunt. My sister Hillary uses the VA shunt system that you see on the right. A newer procedure is called an endoscopic third ventriculotomy. An endoscopic third ventriculotomy is newer than a shunt system and works best on non-communicating obstructive hydrocephalus. Basically, a neuroendoscopic tube is inserted into one of the brain's ventricles. CSF can flow through the tube. Then, a tiny hole is made in the ventricle of the brain, then dilated so that the CSF has someplace to drain. Possible side effects of hydrocephalus. One of the side effects of having hydrocephalus is the lack of appropriate social skills. 3 common issues with this lack of social skills are difficulty picking up social cues. For example, not recognizing that a police officer is somebody who would be in charge and somebody you would need to listen to. Also, difficulty perceiving vocal intonation. That means, for example, if a child was invited to a party and somebody said, "Yeah, I'd really love to have you at my party," a hydrocephalic person is not going to understand the emphasis on really and assume that they're excited about having them come to the party when in fact they would rather not have them there. Also, misestimating distance and spatial relationships is common for people with hydrocephalus. That just means that they get in your face. Possible cognitive and physical issues include lack of peripheral vision and frustration and lack of patience. What can we as music therapists do to help those with hydrocephalus deal with problems with social and cognitive skills? Well, the usage of prescribed music therapy practices for those with social and cognitive issues can go a long way towards helping them cope in what can often be a confusing world. The usage of social stories or social songs can be especially helpful for those who have a hard time reading nonverbal and posture cues. While those with hydrocephalus can perceive happy and mad and perhaps sad, other, more subtle expressions are completely lost on them. While they may eventually catch up with their peers on this skill, by the time they have caught up, it is often too late to begin to make friends with peers they have known for a long time. Musical games can be used not only for learning social skills, but also for cognitive skills, learning patience, and attention to detail. Musical movement activities can focus on gross and even fine motor skills. This is a picture of my sister, Hillary, taken at her wedding just a few years ago. She is a successful phlebotomist and lives in the Boston area. She's married and the proud quote-unquote parent of a pet dog and a pet rabbit, which personally I think would taste great with some mint sauce, but she doesn't like it when I tease her about that. Hydrocephalus is not something to be scared of. Once you know a person has it in your life, just make sure that they get the treatment that they need. The following is a list of sources that I used to help me with my presentation today. Thank you for watching, and I hope this has been informative for you. Have a terrific day.